Well, hello, everyone, and welcome to the 2022 Platinum Ambassador Assembly. We're going to go ahead and get started. We know that some folks will be trickling in, but we want to get right to our program. We hope that you have enjoyed watching our pre-recorded videos and that you feel really prepared, but we will go through everything this evening while we are all here together. And we also just wanted to take some time this evening to recognize you all, to do some Congressional Awards, and to have representatives from Soapbox on to talk through scheduling and all the things that you need to feel fully prepared for tomorrow. So I just want to take a minute actually before we get started in the program itself to reflect on where we've come in 2 years, because many of you who have been Platinum Ambassadors for a while, you may remember 2 years ago was when we were anticipating having you all with us. We were calling it our Advocacy Leadership Retreat, and with roughly 72 hours notice, with the coronavirus starting to make its waves through the United States, we canceled and turned it into a virtual event. And we still pulled off, I think, a good program. And some of you were still able to connect with your legislators. But it's really been, thinking about that 2-year mark, quite a couple of years. I'm really grateful that we were able to get together virtually this year, even though we're not quite ready for in-person yet. And the Hill is not quite ready for us yet either, but we hope that'll change in future years. But we've come a long way in terms of virtual advocacy, and there's certainly silver linings to folks who aren't able to travel or can't take time off of work or things like that. We know that a lot of you have had the opportunity to advocate in ways that were not maybe available to you before. And we've been able to really cultivate a new generation of what we hope will be long-term advocates who we wouldn't have been able to reach before. So that's one silver lining I take with me. But with that, I'm going to just do a little bit of housekeeping and say that we want this to be an organic conversation. It's a fairly intimate small group with just the Platinum Ambassadors this evening. So please use the chat function and the Q&A function liberally with any questions that you may have. You all are on, just because of this is a webinar recording, you're on mute and off of video, but the chat and Q&A are there, and we will be monitoring them throughout. So with that, I want to start by recognizing a couple of groups of people. One is our Platinum Ambassador Task Force. We could not have done this without them. They helped from top to bottom, everything from timing to session topics and speakers and everything in between. So Andrea Abramowitz, Deb Constein, Lauren McAllister, Patrice Johnson, Paula Haney, Roseanne Wynn, and Shara Goff. We really appreciate your time and dedication and spending all of those hours with us over the past few weeks. And then I also want to recognize the National Advocacy Committee, several of whom you'll be seeing this evening, and their names are up here, and you'll see some crossover there as well with some of the folks I just mentioned. But again, we can't do what we do without them. Their ideas and insights and guidance really make a huge difference in our program. Okay, so next, I am going to just quickly recognize our sponsors as well. Bristol Myers Squibb, Janssen, Merck, and Pfizer, who have made this evening possible. And then I think that is all of the housekeeping for me. So I am going to turn it over to the person who is our keynote this evening. He is also our CEO, Steve Taylor. You might remember, those of you who are with us last year, that he joined us for a fireside chat at last year's event, and it was his first day on the job. So he has been with us for a year now, and he has come a long way in that year, learning the organization, meeting many of you virtually and otherwise, and becoming our CEO, which we are incredibly grateful for. I am going to tee him up now. I know he's got a handful of slides that he wants to share. Any questions that you might have or topics you want to hear from him, go ahead and put them in the chat. And when he finishes with a handful of remarks about what he's looking forward to and his vision for the Arthritis Foundation, I have a couple of questions for him myself, and then I will share some of your questions with him before we move on to the awards part of the ceremony tonight. So with that, Steve, I am turning it over to you.
Thanks, Anna, and thank you to the entire advocacy team, as well as all the amazing volunteers for all their work year-round, making sure the voice of the arthritis patient is out front and center in front of state or federal legislators, as well as other regulatory agencies. Without your voices and without your stories, we aren't going to see movement in where we know we need to see movement. So I thought I'd share a little bit about my background for those that might have not met me yet or not seen me on an event, just to share a little bit about who I am and where I come from. On the next slide, you'll see my most pride and joy, which are my three sons, my twin boys, Jack and Owen, and my youngest, Austin. We were running in the Jingle Bell Run, and many of you are very familiar with that last year. Awful cold here in the Washington, D.C. market, but thrilled to have taken part. But they are the reason I do what I do often, because they also fight for those that need a voice. They're all engaged in various civic and community organizations, and of course have been very committed to my entire career. They have been to probably more walks than most average 20-year-olds, I can say, because between the Heart Association, where I was 18 years at the Sjogren's Foundation as president and CEO. And then, of course, now arthritis, they have been to so many events. And in the past year, a lot of virtual events. This was our first one in 2 years to get out there and actually take part in a live event. So thrilled to be there. If you want to go to the next slide, I didn't want you to have to stare at my three boys while I talked a little bit about my background, but I hinted a little bit about my background. But I went into nonprofit because during my senior year of college, my grandmother and my father both passed away to lung cancer. My mom's mom, my grandmother on that side, was 62 and my dad was 44. And during my senior year, I was going to go to law school, and I got admitted to law school and was excited about it, but then decided I was going to take some time off after college since they passed away my senior year. And so I deferred my admissions to law school. And what I did was I ended up with a job at the American Cancer Society that summer after graduating, and really found my love in nonprofit and how I can make a difference. Loved my time at the American Cancer Society. It took me to the American Heart Association, where I was for 9 years, and then where I became president and CEO of the Sjogren's Foundation for the last 18 years before joining arthritis last year. You know, I chose my organizations very specifically. They were in causes that mattered to me, and organizations that had patients that I felt I could make a difference for. And the Arthritis Foundation is no different. I believe in this organization. I believe working in the rheumatology space for the last 18 years at Sjogren's, I surely understand the challenges with a chronic disease like rheumatoid arthritis or psoriatic arthritis or gout, as well as juvenile arthritis. At Sjogren's, I launched the Pediatric Sjogren's initiatives, which was the first time ever in Sjogren's that they looked at pediatrics. I'm very proud of my work there. And of course, osteoarthritis as well as a chronic disease. And we all know all about OA, but those are really what I believe in fighting for, is making sure that those patients have a voice and people understand the severity of those diseases. I think oftentimes chronic diseases get underplayed, or people who have them oftentimes share the story that they're just fine. They'll say, "How are you?" And a patient will say, "I'm fine," because we're all trained to say I'm fine. But we know that day you might not have been able to get out of bed for an extra hour, or you couldn't go down the stairs without sitting on your behind to go down the stairs, or you had a problem getting to the car, or you needed help carrying a box in the office, whatever it might be, but you still say I'm fine. And so I believe we need to make sure those stories are told and make sure people understand how these diseases affect every part of a person's life. And our mandates for action and our How It Hurts report last year show how these diseases impact every part of everyone's life. And so I was very committed and excited to join the Arthritis Foundation. And as Anna said, I'm honored and thrilled to be the new president and CEO as of February 1st. You know, I'm going to share a little bit about our 3-year vision, not spend a lot of time, but I do want to highlight it a little bit, and surely then talk a little bit about my first 30, 45 days as president and CEO as well, and then take questions. But as you all know, on the next slide, you'll see our impact objective. And I want to call this out because when we started to put together our 3-year mission plan, we looked at this bottom line on here, our impact, which was to create a reputation for the Arthritis Foundation as the cause leader for audaciously attacking arthritis and its effects. We want to be the cause leader for healthcare professionals. We want to be the cause leader for research and science in arthritis. And we want to be the cause leader where patients look to us first and call us after being diagnosed and network with us, and that we're able to help empower them and help them live with their diseases. And so there's a lot of work to be done to hit this impact. And so we went into our planning for our 3-year plan with this impact objective in mind. On the next slide, you'll see something that you're very familiar with, which is our 2 pathways, our pathway to a cure and our pathway to improved quality of life. Those are our 2 pathways that we really delved into as we put together our 3-year plan to make sure that we're moving those 2 pathways forward, that we're getting down those pathways further than we've ever been, and changing the lives of our patients. So on the next slide, you'll see a more detailed screenshot of what we did with our 3-year plan. So we started with our impact objective and, of course, our mission to exist to conquer arthritis. We looked at our network, which you're all part of. Our network is where we deliver our programs, where we make our statements, where we advocate, where we hold our local events like JBR or Walk to Cure Arthritis, where we have our connect groups and our webinars. Our network is where we deliver everything. And that network then helps us fuel and fund and support our 2 pathways. Our pathway to a cure, I'm not going to spend a lot of time tonight on it, but is obviously our work in our science arena. This is where we focus on our science initiatives on OA, RA, and JA, where we're funding research grants and big initiatives that are starting to unlock the mystery of those diseases. This coming year, you're going to see clinical trials start in osteoarthritis with our work with our OA Clinical Trials Network. We just launched and awarded a $2.5 million grant to Brigham Women's Hospital in Boston to be our coordinating center for our clinical trials. And we are thrilled to have them on board to help us move forward in these initiatives to start to really look for a biologic or a therapeutic that will help OA patients. In addition, our work in RA, we are going to be looking in various areas where enough research has not been done. We know there's great products on the market for many patients who have RA, but we also know that those products don't work for everybody. So we're looking into those products that don't work for anybody and why. We're also looking at comparative effectiveness to compare the different treatments that are on the market and why they work for some and why they work differently for others, and figuring out a pathway for patients about which potential treatment they should go on first, because we know because of their biomarkers or because of their age or gender, whatever it might be, that it'll work better for them. So we're working in the RA space to fill those gaps of research that are needed. And then in our JA space, we're very committed to working both with CARA as well as with our own research initiatives in the JA space, especially around transition as children age into 18, 19, and 20 years old, how they transition to adult rheumatology, how they're treated differently in regards to their treatments, and then looking at how that transition happens. And so you'll see new initiatives coming from us as well in that area. And then workforce development. We all know that there's not enough rheumatologists, there's not enough pediatric rheumatologists. And so we continue to work in that area to help with our fellowship program to make sure that medical students are choosing rheumatology. So important, but also that we diversify the workforce as well. So we have a very large DEI initiative to really look in how we diversify the workforce for both pediatric and adult rheumatology, and how we attract those bright minds that bring diverse thought and diverse backgrounds into the field. And so our workforce committee is very strong in this area, and we're very excited about what's going to be coming out of that work over the next couple of years. And then you move to our improved quality of life side, and that includes our pain initiative, which is our educational programming and our webinars and all of our website materials and our downloadable materials that we have for patients and our outreach to doctors. Everything we do in education around all the various forms of arthritis is part of our 3-year plan. And we really came up with 4 focus areas that we're going to focus on in this, which includes general awareness, focuses on focused and targeted programming. So we're going to be looking at those that have a disease and focus on them. For example, women with RA, or women in childbearing years with RA, or men with psoriatic arthritis, or veterans, and do some focused targeted programming. Then we're also going to be doing empowerment and solution-driven programming, which is going to focus on how we empower patients who have these diseases to live the life that they want to live and to give them solutions to how to do that as well. And then finally, which is why you're all here today, you're already in the 4th bucket, which is called advancing our mission. how we can convince our patients and our population not only to learn to live with their disease and learn from all of our unbelievable education, but how do we get them engaged to become advocates in advancing our mission? How you get them involved in the science of our work. And that's what brings us to our final box on this chart, which is our continuity of care, is working on this ideal model of care that we know will help patients live a better life. And we know some of that work has to be done through our advocacy arms, both on the state and federal level. And that's where tonight and this coming year, you're going to hear a lot more around the Continuity of Care project on developing the ideal model of care. When a patient is diagnosed, what is the ideal care they should receive? And then what are those barriers to that care? How do we break down those barriers? We know that some of those barriers include things that you're already advocating on, which you've not stopped advocating on: step therapy, out-of-pocket costs, other pain treatment options. But we're going to be looking at additional barriers that get in the way of making sure patients receive the proper care they deserve. And so that work will be done in our continuity of care bucket and led by the advocacy team, Anna Hyde, and the amazing team that she has behind us and all the volunteers. On the next slide, I go into 3 different slides that I want to share with you just quickly before I take some questions. But my first 30 days here at the organization, I actually talked with all 165 staff members of this organization. I did it in small groups, 28 small groups, and 15 one-on-one meetings with single individuals, and really listened about what they think we need to do here at the organization. And I also talked to numerous volunteers, national board members, and others that are out there in the field as well. And I came back and came away with 3 things that we need to do a little bit better here at the organization. And I want to preface this with the staff have been working so hard and the volunteers throughout COVID. Surely I come in with a fresh pair of perspective because I'm new, but I also am not living with the ramifications of COVID. I'm living with the new focus of the future. And I want to thank my predecessor, Ann Palmer, and the senior leadership team and the national board who got us through COVID and got us to this point that now I can look forward. So it is a little easy for me to share these, but I don't want to downplay those that came before me and what happened here at the organization either. But one thing we need to do is simplify and streamline. As many of you know, we do well at complicating things here. And so a number of things in this bucket fell into this in regards to how we can streamline and how we can simplify. A couple things I'll just mention. One is telling our story convincingly and compellingly, but simply, so people can follow us and understand what a difference the Arthritis Foundation is making. In addition, how do we deliver our programs, how our technology works? We need to simplify and streamline that. The second thing I heard the most on the next page is transparency. We need to be most honest and open to really discuss how to be transparent amongst each other in the inside the organization, as well as inside the organization with our volunteers, sharing what's important to all of us. And on the next slide, you'll see the word transparency. You're not missing anything since it didn't move forward. But is the idea of making sure that we're honest with each other. We're having open conversations to make sure we're making the best decisions and that we are including the right voices in the room to make sure that, I always talk about DEI. Diversity is very important, but the I in DEI is equally important. Inclusiveness, making sure that the right people are in the room. It's diverse of thought and background, race, ethnicity, everything, but that they're included in the conversation, not talked to, but listened to, and having those conversations with each other to help move the organization forward. And so you'll see us working in this area and making sure that as many people in our decisions are included. And also looking at volunteer driven versus volunteer powered is another transparent method I want to look at. I believe we are powered by our volunteers. We would not be where we are today without our volunteers. We need our volunteers, all of you, to move forward. We really are volunteer powered, but we need to make sure we explain to our volunteers what that means and make sure that the right documents and the right information is being shared with all of you to make sure we're as transparent as an organization as possible. And then finally, on the last slide, you're going to see my third bucket, which is focus and deliver. We need to make sure we're focusing and delivering what we need to do to make sure we hit these 3-year marks and make sure we're hitting our goals each year. Ideal model of care is a great example. Focusing in on developing that this year so that when the 118th Congress takes office next January, we are ready and able to hit them with what ideal model of care for arthritis looks like and how they can help to make a difference for our patients by passing legislation, changing rules and regulations, and how we can really make a difference either at the state level or the federal level moving forward. And so you're going to see us focus and deliver everywhere in this organization. We're going to have to say no to some things because they just don't fit right now. But if they are a great idea, they'll still be around in 6 months or a year and we'll bring them back. But we're going to focus and make sure we deliver long-term for the organization. So with that, I'm going to turn it back to Anna. I know I shared a lot, but Anna, I don't know if you have any questions. I don't know how much time we have left, but I want to turn it back to you to ask me anything that came up in the chat or ask any question that you might have gotten before tonight as well.
Absolutely. We did get a handful of questions from our task force before the event tonight, and I want to encourage everyone to use the chat function or the Q&A function if you have any questions right now. So one of the questions that had come in before, then I have a couple of my own, was what was your philosophy working at Sjogren's and like how is that translating here? Like what philosophy did you develop over the years that you were there, and how are you bringing that forward to the Arthritis Foundation?
Sure. I appreciate the question. Surely I was committed to Sjogren's for 18 years. My mom is a Sjogren's patient, so I understand how it is to live with the chronic illness through my mother. But I knew I might get this question. I thought a lot about it. If I had to narrow it down, I would say patient first. I always believed in everything we needed to do at Sjogren's and here needs to come together with the patient in mind and how it's going to make a difference at the end of the day. Healthcare providers are critical to delivery of care, but at the end of the day, it's the patient that has to get the change in their care. It's the barriers the patients have to overcome. And so, yeah, we might rock the boat. We might upset a few physicians. We might upset a few Congress people. We might upset CDC or NIH, but we've got to do what we know is right for the arthritis population and the arthritis patient. So I would have the same philosophy here. And I brought it last year, as you know, working alongside me, Anna, this past year. And of course, I had the pleasure, many of you know this, to work alongside Anna outside this organization and look up to Anna and the amazing leadership she has here at the Arthritis Foundation. Working as the CEO of Sjogren's, I was on many coalitions with Anna. But really, I think you know that I really full-heartedly believe in that patient-first mentality and making sure we're looking at how it's going to change the life for our patients.
That actually is kind of a good segue into one of my own personal questions, which is what fun, funny, terrible, great, and anything in between advocacy exposures or experiences or stories have you had from the past, whether it be at the AF or at Sjogren's or elsewhere? Any fun stories?
I have many experiences on Capitol Hill. I've been there with Anna. I've been there on my own, been there with my own coalitions. So many things. I've testified in front of House and Ways Means Committee, and that's extremely stressful. I will say probably my most stressful time in advocacy over my career, and Anna lived this with me. I was CEO at Sjogren's. She was here, but was the hydroxychloroquine shortage, and fighting and rocking the boat a little bit politically against what we knew was wrong information. And yet it still caused a major shortage in our population. And that was extremely upsetting to our populations that took that. Sjogren's was the first line of defense for Sjogren's hydroxychloroquine, and not being able to get that and being told to go on other medications. Us standing up for them was critical. And we had to go against some that felt we should support leadership, and we felt we needed to stand up for patients. And so we did that. I will share a specific story that came from my Heart Association days that really changed my mind about how much difference face-to-face and individual meetings, not always face-to-face, of course, we can do them virtually, matter. But I went with the Heart Association to Capitol Hill, met with a congressman, and his lead healthcare policy person was a young gentleman. His father had had a stroke just recently, and he sat there telling cardiologists and myself and patients that he didn't have any risk of a stroke because his father didn't take care of himself. And the cardiologist told the story, how much more risk he was at having a stroke. He had no idea because it was now a family history of his family. And he was downplaying legislation that he knew nothing about. And what I think it reminded me, and still reminds me to this day when I meet with different state aides and also those congressmen themselves, they don't have health degrees. They don't all live with chronic diseases. They don't understand all the diseases. It's too much for them to gather. So your stories and your voices matter way more than sometimes you think. Even if you don't make groundswell that day or make a difference that day, you are planting a seed that they will remember the next year or the year after, or when their mom gets diagnosed with something, or their wife or their sister or their husband. You're planting that seed to remind them that the chronic disease patients aren't going to go away, and those with arthritis deserve the attention they deserve. And so I remember that day, and I will tell you that congressman started to come around and start to support Heart Association legislation. And I was not lead advocacy by any means. I was just a small staff member that went back then. And I never forgot that difference that one day made with that congressman's office, because we had the right people in the room for that appointment. So just remember that as we move forward.
That is, I think, a great tip, and really speaks to the way we sort of talk about advocacy and the power of the patient story, and how, you are the expert in your story, and that is the lasting impact typically that a member of Congress will hear. Okay, so a couple of questions in the chat have come in. One is around the transition from pediatric to adult rheumatology, and what we might have on deck, or what our thinking maybe around how to make that sort of connection better, because there's a continuity of care issue that often happens with folks when they're transitioning from pediatric to adult. And do we have any programming around maybe bringing those two specialists together, or something like that?
A couple of things in there. So Anna and Elisa, and I know Stephanie, we're just joining a new coalition with other diseases that have the same challenge with transition. And so it surely won't be specific to the rheumatology space, but we're going to be looking at advocacy efforts to change how transition happens for youth to adulthood. I didn't mention my son was born with spina bifida, and so I surely know the plight of a parent fighting for your child. I was fighting for Austin the day he was born and had surgery at 2 days old. I've been very fortunate. Austin has had no side effects after his 3.5-hour surgery at 2 days old. But I worried that day. So I know how, and I worried that week and the next few months, every appointment until he was fully cleared. And so I know how it is to be a parent that lives with that fear and that concern, and then wanting everything they can for their child. And so I will always fight for the pediatric population. JA will be a cornerstone of this organization, but we have to look at them as young adults as well. And then I know someone mentioned the ripple effect. I know you're talking broader for all arthritis, but the ripple effect in a youth family when they're diagnosed is large. And so we'll be working on programming. But in regards to the transition, is making sure those young adults are ready for transition. We are funding pediatric and adult rheumatology fellowship programs that mirror the two. So a ped adult rheumatology fellowship that's helping bridge. I think we have to do more of that, where pediatric rheumatologist and is also an adult rheumatologist, so they can have a transitional doctor. We're actually funding a study and a program in Philadelphia on that this very year, actually. And so we'll be looking at more ways to help with that facilitation, as well as looking and advocating for more specialists in hospitals that help, in medical academic settings that help with that transition, making those connections for families from their pediatric to an adult rheumatologist. And I'll say this with all due respect to any rheumatologists on the call, you don't need this if you're on this call, you probably are very committed, but an adult rheumatologist that appreciates the pediatric side of the disease. Going to any, as you know, if you're a parent who's asking the question, just going to any adult rheumatologist isn't the answer. You got to find one that understands the intricacies of transitioning a child to adult. So we are working on that. Programming is happening and funding is happening in that very area. And then the last question I saw, Anna, was around the families. We will be doing additional conversations and ripple effect conversations around empowering families to be involved, but also how it is to bring your families along for the journey. We know that, with my mom having Sjogren's, it's a family affair. It also is a family affair because sometimes patients aren't honest about how they're really feeling. I'll never forget, my mom goes to a meeting. My mom says she's fine. She does great. She works full time. And my stepfather will be there and will say, well, she goes to bed at 7:00 every night. Her fatigue is not great. Her joint, a family member is more honest than sometimes the patient. And so having them work together as a unit, families together, is very important. So you'll see more programming around that for sure, especially in our focus programming, to make sure that families are brought along and educated as much as they want to be about their loved one's condition. So So hopefully I answered those questions, Anna, and I know we probably way over time, but I appreciate the opportunity.
Well, I have one other, this isn't really a question, but more that question just reminded me. Are there any in-person or virtual events or things coming up this year that you might want to plug so folks can learn more about all of these types of things at some of our events coming up?
Great segue, and I appreciate that promotional opportunity. First, I hope you all are going to take part in your local Walk to Cure Arthritises, which is in May and June. Most of them happen. I hope that you have those marked. Bring your family, your friends. No matter if they all fundraise or not, please be there because numbers matter for our sponsors and for everyone else that shows up. So I encourage you to drag as many people with you as you can. And then finally, the big thing coming up this spring is June 2nd to 4th is our Pathways Conference. It's going to be in Kansas City, and we are going to be having speakers on physical health, emotional health, advocacy, science. All of our science initiatives are going to have breakouts on those very things. How you can bring this back to your community. It'll be the final sessions to really bring it home for all of you. So I hope that you'll all mark your calendar and come to Pathways June 2nd to 4th in Kansas City. The advocacy team will be there doing their breakouts along with some special guest speakers, and we have some great surprises, including, of course, great Kansas City barbecue. So we'll have a great event for sure. So thanks for that opportunity, Anna.
Oh, you bet. I appreciate Dennis Ayling's suggestion that the CCC is number one. Pathways also. It's a close second, maybe.
I will say, since Dennis Ayling is on, I did buy a bike this weekend, Dennis, and I am, as you know, committed to kicking off CCC and riding the first 85 miles. So I will tell you about my bike later, Dennis, but very excited.
Well, we have a team that is growing, and I'm looking forward to getting back on the bike as well this year. Okay, thank you, Steve, for your time. Appreciate it so much. It's a great, I always love like the advocacy event being kind of early on in the year. So you sort of set the tone, and it's always a good one. All right, so I'm going to tee up Deb Constein, who's going to carry us into the next part of our program, which is where we recognize all of our Platinum Ambassadors and move into our Congressional Awards. So Deb, I'm going to turn it over to you, and I'm going to take myself off video.
Hi, everybody. I had to look down just to make sure I was off mute, as I think we can all laugh at. Steve, that was great. I so appreciated learning so much more about you, and really appreciate everything you do for the foundation, and welcome all new ideas. So as we move into the awards portion of the evening, I wanted to thank all of you guys once again for attending this event, whether it be the Advocacy Summit, Platinum Ambassador Assembly, or a lobby day. We know that the real highlight of the event is all of you and all of you, the advocacy volunteers. So as most of you know, the Platinum Ambassador Award is given to the ambassadors that engage at a high level throughout the year. Over the years, hundreds of ambassadors have achieved this award, and many of you, like me, have been a Platinum Ambassador for many years. You know, that's one thing as far as being an ambassador. I always thought it was more political. So that was what I always shied away from. But I will say Pam Fields and Lori Oblock, they were the ones to open the door to advocacy for me. And it hooked me like hook, line, and sinker. And I haven't looked back since. So we are thrilled to see 51 Platinum Ambassadors from 2021. The 51 Platinum Ambassadors, all of you here today, hail from 25 states and the District of Columbia. So we would like to take a moment to recognize all 51 of you for all of your hard work, passion, and dedication to advocating for arthritis. I'd like to invite Stephanie Livingston, our Advocacy Director of the Arthritis Foundation, to join me in reading all of the names. So as we read these names, feel free to send some words of encouragement and congratulations in the chat below. So that would be fabulous.
Wonderful. We'll advance the slides here. So I'm gonna kick us off, and we're gonna rotate back and forth. Again, like Deb said, feel free to send your congratulations in the chat. Make sure you change it to everyone instead of panelists only, and everyone will be able to see. So I'll kick us off with Andrea Abramowitz from Florida.
Michelle Aldis from Florida.
Karen Anderson from California.
Heidi Barrett from Washington.
Ethan Berkovitz from Ohio.
Joanne Berkovitz from Ohio.
Lisa Broom from Washington.
Courtney Bruce from Washington.
Kelly Chellis from Ohio.
Ella Chinta, oh, I'm going to kill this one. I'm really sorry. I'm even looking at the phonetics. Ella Chintagunta from Illinois.
Christine Sissio from Pennsylvania.
Sarah Cloud from Missouri.
Jerica Code from California.
Alyssa Comer from Tennessee.
Deb Constein from Wisconsin.
Cindy Copenhaver from Illinois.
Katie Copenhaver from Indiana.
Tiffany Crawford from Oklahoma.
Brenda Dalton from Oklahoma.
Stacy Dick from Indiana.
Christine D. Desidero from New York.
Carrie Ferraro from Pennsylvania.
Peter Fisher from Arizona.
Anita Frickless from Colorado.
Kathy Geller from New Jersey.
Laura Genovese from Washington.
Shara Goff from Nebraska.
Julianne Goodfellow from the District of Columbia.
Kathy Garant from Ohio.
Paula Haney from Connecticut.
Angela Harrison from Indiana.
Patrice Johnson from California.
Abby Kasperwicz from North Dakota.
Helen King from Pennsylvania.
Brian Lershaw from North Carolina.
Barry Lynch from Maine.
Lauren McAllister from Tennessee.
Sydney McConnell from California, or Colorado, I'm sorry.
Amy McCormick from New York.
Meredith Meyer from New York.
Keith Moshida from Tennessee.
Patricia Neely from Georgia.
Shannon O'Hara Levi from New York.
Shannon Raglan Lake from Georgia.
Carol Riley from Delaware.
Jennifer Ross from Florida.
Anna Sutton from Washington.
Susie Sass Palmer from Virginia.
Brittany Thomas from Arkansas.
Roseanne Wynn from Colorado.
And Carrie Wong from New York. So congratulations, everybody. We wanted to make sure we went through and read all of your names, but I'll pass it back over to Deb to finish us out. Congratulations, everybody.
Congratulations, everybody. All right, so I'd like to now introduce Susie Sass Palmer and Ted Caldwell for our next set of awards. Susie serves on the National Advocacy Committee, Patient Leadership Council, and is the co-chair of the Virginia Advocacy Committee. Ted is our immediate past chair of the National Advocacy Committee and serves as the Minnesota State Advocacy Committee chair. Susie and Ted, over to you.
Thanks so much, Deb. Congratulations to you and the other Platinum Ambassadors. We couldn't do what we do without your help and without your leadership. Now we're transitioning to say we're pleased to announce the 2022 Congressional Leadership Award. This award has been presented every other year in recent history, and it goes to members of Congress or the legislative staff that have championed policy work that moves the needle for the arthritis community. As we all know, legislators are a critical stakeholder, not only in the legislative process, but in advancing the goals of the Arthritis Foundation. Susie?
Thanks, Ted. This year, we are thrilled to award 2 members of Congress for introducing legislation that ensures all arthritis patients can afford their medications. Representative Donald McEachin of Virginia and Representative Rodney Davis of Illinois introduced HR 5801, the Help Ensure Lower Patient Copays Act, also known as the HELP Act. The HELP Copays Act is a 2-part solution that eliminates barriers to treatment for those who live with serious, complex chronic illnesses like arthritis. This bipartisan legislation would guarantee that patients can afford the medications prescribed by their doctors. The HELP Copays Act requires health plans to count the value of copay assistance towards patient cost-sharing requirements. Having all payments count towards their out-of-pocket costs, whether they come directly out of a patient's pocket or with the help of copay assistance, would bring much needed relief to arthritis patients. As a constituent of Representative McEachin in Richmond, Virginia, I'm pleased to present the 2022 Congressional Leadership Award to him, as well as to Representative Davis. The congressman, unfortunately, could not join us live this evening, but we do have a special video message from each of them. So let's.
Hi, I'm Congressman Rodney Davis. I want to say thank you to everyone at the Arthritis Foundation for your advocacy and work to ensure better health outcomes in our local communities. I'm honored to receive the 2022 Congressional Leadership Award. Together, we can continue to help raise awareness and enact policies that ensure patients have access to the care they need. I was proud to introduce HR 5801, the Help Copays Act, alongside Congressman McEachin, to help patients access life-saving treatments by ensuring patients can afford the medications their doctors prescribe. Our bill would allow counting the value of copay assistance toward patient cost-sharing requirements and would close a loophole that allows some health plans to deem certain necessary drugs as non-essential. I look forward to continuing our work to end arthritis together. Thank you for everything you do, and I'm grateful to receive this award.
Greetings, everyone. I'm Donald McEachin, Congressman from Virginia's 4th Congressional District. I'm so sorry we weren't able to be together in person, but I know those days are coming. I wanted to take a moment to share with you my sincere thanks, both for honoring me with your Congressional Leadership Award and for your ongoing support of the Help Copays Act. I was proud to help introduce this bipartisan legislation along with Congressman Rodney Davis from Illinois to protect patients from undue out-of-pocket prescription drug costs. We have all seen the immense financial strain copay accumulator programs can pose for patients. And the coronavirus pandemic has further demonstrated the pressing need to lower the cost of prescription drugs and ensure all Americans have access to life-saving medications. With the cost of goods and services and medications on the rise, patients shouldn't have to face complicated financial barriers. All copays should count. I will continue to fight for affordable, accessible health care for all Americans. I commend the Arthritis Foundation for your ongoing support of the Help Copays Act and your efforts to raise awareness among members of Congress and their staff. Thank you again for this recognition. I look forward to our continued collaboration to ensure all copays count. God bless.
Thank you so much to Representative McEachin and Representative Davis. Thank you to both of you for your continued support of people living with arthritis. This, of course, is the issues that they discussed there are critical issues for us fighting for arthritis, and they will be issues we'll be advocating on behalf of tomorrow when we're doing our virtual visits on Capitol Hill. So now I'd like to pass the baton over to Dennis Ayling. Dennis is based in California. and serves in many roles at the Arthritis Foundation, including serving as co-chair of the National Advocacy Committee, as well as a member of the National Board of Directors. Also, rumor has it that he has some involvement with the California Coast Classic, although he's a little bit reluctant to discuss it, but sometimes you can pull it out of him if you try hard enough. Dennis, you're on.
Thanks, Ted. Yeah, I can never talk about the CCC. It's a real problem. I'm going to overcome it, I promise. You know, as we prepared for the 2020 Advocacy Leadership Retreat, the National Advocacy Committee and some of the AF Advocacy staff had a little secret up our sleeves. We planned for months to create the Pam Fields Legacy Award and surprise her by awarding it to her at the awards dinner at the retreat in Washington, D.C. Well, as we all know, the retreat was scheduled for March 9th, 2020, and we had to make a pivot to virtual on just 72 hours notice. This meant there was no award ceremony and we had to come up with a new plan. We ended up being able to have a member of the advocacy team give Pam the award in person, which might be a story for another time. It included a parking lot and to-go breakfast in separate cars. That being said, the Pam Fields Legacy Award, forgive me, we apparently have an emergency alert where I am. The Pam Fields Legacy Award was created to celebrate and honor volunteers, staff, and other stakeholders that create a legacy in their work with the Arthritis Foundation's advocacy. Pam Fields created a legacy of getting to know every single patient's story to help them share it in as effective a way as possible. Pam worked closely with state advocacy committees to create custom-tailored plans for each legislative session. Pam Fields' legacy of work with the Arthritis Foundation spans more than 20 years, and we are thrilled to carry her legacy forward through this award. I am thrilled to award the very first recipient of the Pam Fields Legacy Award, well, aside from Pam herself, of course. As mentioned, this award was not given annually, but is presented to those that have created a legacy in their work with the Arthritis Foundation. This person has been involved with the Arthritis Foundation for decades, serving on the local, regional, and national levels in various volunteer roles. This person routinely steps up to take on new roles and provide input on policy solutions for common access issues. And I am delighted to say that this person is Ted Cadwell. Ted has been an active volunteer with the Arthritis Foundation for more than 20 years, having served on local, regional, and national Arthritis Foundation boards. He currently serves as the local Minnesota Leadership Board and is the chair of the National Advocacy Committee until just this past January. In addition to serving as a volunteer, Ted knows what it's like to suffer from the effects of arthritis, having been diagnosed with severe juvenile rheumatoid arthritis at age 2. When he's not advocating on behalf of people with arthritis, Ted is a corporate lawyer, one other interest we share, in Minnesota, and an avid sports fan, which we often go back and forth. I first met Ted when I joined the national board. She's probably about 8 years ago now. I was immediately impressed with his incredible insight and appreciation of the patient needs, not just random policy statements, but really what it meant to the patient, but also the motivations of others in our healthcare ecosystem and how to triangulate those motivations to achieve the best for our patients. Beyond that, he is a wonderful collaborator on everything we do. From the very beginning, when I first met Ted, he showed me that he wanted to work together with other members of the board, with other volunteers on everything he did. It was never with Ted, I am doing this, or I think we have to do that, or I want, but always what can we do together? And that has been his MO as a leader for this foundation from the beginning. And it continued. I saw it continue when I joined the NAC a few years after Ted did. He is a consummate leader. He's always been willing to step up and do the hard work himself, but he always is looking for how to be inclusive when he's doing that, to partner with others so everyone has the buy-in into what we're doing. I'd like to spend just a moment right now listening to some other people share just how wonderful Ted has been as a leader in advocacy.
Congratulations, Ted. What an accomplishment. We're so proud of you and glad to have you on our team for past years. Thank you so much for serving as the co-chair for our National Advocacy Committee. It was a joy to meet you this year. Thank you for welcoming me to the team as well and for all of your continued leadership and direction.
Hi, Ted. Words cannot express how much working with you and your being the co-chair of the NAC all these years has meant to me. You took over the chairmanship from the previous NAC and have seen the committee through all of the evolution, all for the better, I would say. And you have been such a presence in the advocacy team, always raising your hand to do whatever it is that is needed, state chairmanship, testifying before the legislature, coming into the healthcare forum. I couldn't have done any of it without you, and that will continue to be true. Thank you for all of your service and work and dedication.
Hi, Ted. I just wanted to wish you congratulations on the Pam Fields Award. Well deserved, and I've enjoyed working with you as a co-chair the last couple of years. Wish you nothing but the best.
Ted, congratulations. I'm so excited for you. This is very well deserved. You have taught me everything I know. And the only thing I regret is that we cannot put together the most spectacular fireworks display to add to your wonderful collection that you've seen so far. Congrats again. Thank you for all of your years of service. We appreciate you.
Ted, I can't begin to tell you how inspirational and frankly educational you have been as a leader of our advocacy program for so many years. I've learned so much from you. I've been inspired by you. I continue to be surprised by you and your insights. Thank you for everything you've done for us, and we look forward to continuing to have you lead us in many ways as we go forward.
Congratulations, Ted, on receiving this year's 2022 Pam Fields Legacy Award. You're so deserving of this honor. You've approached every interaction that I've had with you on the committee with humor and joy and real tenacity for the foundation and our advocacy goals. And it's just such a great honor to serve with you. And congratulations again on the award.
Hey, Ted, congratulations. I couldn't think of anybody else more deserving than you. Thanks so much for all that you do for advocacy and for fighting for our warriors and for just paving a better future for them all. Your work is so important and we appreciate it. Congratulations.
Ted, congratulations on being the recipient of the Pam Fields Legacy Award. It's always an honor to work with you here on our local leadership board, and it never ceases to amaze me at all of the various areas that you're involved with, both on a local level as well as a national level with the Arthritis Foundation. Thanks for all that you do, Ted.
Congratulations, Ted. In all of your roles at the Arthritis Foundation, you have certainly created a legacy of sharing your story and making positive change for all people living with arthritis.
Hey, Ted, it's Steve Lurch. Just want to say congratulations. I can't imagine anybody being more deserving of this award than you, whether it's on the national level or at a local level. With us here in Minnesota, your dedication is unbelievable. Thank you for all you do. And on a personal level, since I've been on this journey with you for the last several years now, I just want to say it's been a pleasure to get to know you and the good man that you are. Congrats.
Ted, congratulations on being awarded the Pam Fields Legacy Award. Your advocacy work has touched so many people's lives and made a difference. And I know that advocacy will just keep on going and you'll continue to make a difference. Thank you.
Hi, Tad. Congratulations on your award. I know that the AF and the advocacy team have appreciated your hard work over the past years, and we are so glad to have you with us.
Hi, Ted. I want to thank you for your contribution to the Arthritis Foundation. Congratulations. You deserve to be acknowledged for all you've done for the arthritis community, not only in Minnesota, but across the country for the last 20 years.
So Ted, if you could turn on your camera and maybe share just a few words with us.
I'm overwhelmed by this. I'm so appreciative of everything that everyone has said. I thought that I did my little presentation. I thought I was done for the evening. I certainly did not see this one coming. I appreciate all the kind remarks that people had and willingness to lie on my behalf. The checks are in the mail, and based on the comments, I got a lot of checks to write. So, but you know, you were overly effusive in your praise. I've done what I've had to because I believe in the cause. I've suffered from rheumatoid arthritis, juvenile rheumatoid arthritis since age 2. So I've had more than a half a century of living with it. So it's obviously a cause that's near and dear to my heart. But none of the things that I've done or advocated on behalf of would be possible without leaders like Dennis and Deb and the staff and Anna and her team and the leadership we have from Steve and Ann and everyone else that I work with over time. So I'm just a small contributor in the overall organization, but want to do all that I can because, as I say, it's the cause is certainly near and dear to my heart. I'm also honored to be following in Pam's footsteps. I don't know that I deserve to be, and I know all that Pam has done, and don't think I deserve to stand in her footsteps, but I am honored to do so. But I'm not going away. I'm still going to be around. I'm still active and involved. So this is not a retirement speech. So I will be meeting up virtual visits on Capitol Hill tomorrow and undoubtedly in the years to come until these guys tell me, you know, get out of here. We've heard enough of you. But until that happens, I'll still be around to contribute and occasionally needle Dennis and others. But many, many thanks. I appreciate this award greatly, and thanks again. Quite an honor.
Congrats again, Ted. Really so well deserved. All right, with that, I'm going to pass it back to Anna and Elisa. And I think you both should.
Right. Yes, thank you, Dennis. Congratulations, Ted. That went exactly as we hoped it would. That was amazing. I also just, if there's anyone else on the panel who wanted to say something that didn't get a chance to about the awardees, I wanted to make sure that that opportunity was open because it was very incognito. Okay. I also realized that as it's getting darker here, the lighting is terrible in the room that I'm in. Anyway, okay, so Elisa Vitalich, who's our policy director, is with me to kind of get into the nuts and bolts of why we're here tomorrow doing our legislative visits. We're going to transition into Soapbox, who's going to be able to answer any questions that you could possibly have about your schedules. But in the meantime, we want to just reiterate what the asks are real quick. And if you have any specific questions about them, feel free to throw them in the chat. So maybe what we'll do is I'll go through just like top line, what are the 3 asks? I'll turn it over to Elisa to give more of the specifics about, you know, the bill numbers, all those little things that you want to, you know, keep in mind, where you can find that information, where all the materials are, and then we'll just segue from there into Soapbox. So with that, as many of you know, we have really honed in this Congress on pocketbook issues. That is a phrase that we've been using ever since Steve Taylor sort of led us down that road last year. I would say coined it, but anyway, and it's really helped us to kind of think about what are we really trying to solve for this Congress. And a few of these issues you all have been working with us on for a while, but we really feel like there's something for everyone here. We didn't want to hone in on just one thing, especially with our Platinum Ambassadors. So we took 3 different issues that we're really trying to make traction on this Congress. So step therapy is one of them, as you all are very aware, whether it's at the state level, because we're so active there, or federally, been working on this issue for 3 Congresses now, but there is a House and Senate bill for the Safe Step Act, which provides guardrails around the practice of step therapy. I do think it's important to emphasize that we're not saying step therapy should be all out banned. We're just saying that it needs to be appropriately utilized, and that oftentimes it's not. And that's where your stories come in of examples that you can share around when that hasn't been true for you. And then the Accumulator Bill, that's what we're sort of affectionately calling it, but you heard a little bit about that already from our congressional awardees who are our bill sponsors. So there's a House bill, but not a Senate bill. That's an important distinction to know because it affects your ask. With the Safe Step Act, it's a little easier because it's just co-sponsor this, whether you're House or Senate. With this bill, it's a little trickier. There is the House bill, the Help Co-Pays Act. There is the House bill on the Senate side, though. It's more of a, we would like you to consider introducing this bill because we need to have a Senate counterpart to the House bill. And then the third one is the trickiest because it doesn't even have a bill number. It's more of a concept, which is we really want to take those Medicare Part D, those prescription drug costs and cap them. A lot of people are shocked to learn that Part D out-of-pocket or drugs don't have out-of-pocket caps because commercial plans do, as many of us know. And so that's been something that we've really been working towards for quite some time now, several years, in fact. And it's not that it doesn't have a bill number. It's more of a proposal that's embedded in a number of different larger bills and vehicles across the House and the Senate. So to keep it simple, we wanted to make the ask just support a cap in Part D out-of-pocket costs. And we don't really have an opinion one way or another about which vehicle that should be. We just want it to be hitched to somebody's wagon. So Elisa, I'm going to turn it over to you to give a little bit more of the technical pieces, bill numbers, and other things that folks can keep in mind and what they can expect with their handing out the materials tomorrow and that sort of thing. And then Kevin can come on and talk more specifically about schedules.
Yeah, that sounds great. Can you all hear me okay? Perfect. Always like to make sure with these handy dandy headphones so you can hear me before we start talking. So you'll see in the chat, Stephanie shared a link to our Assembly event guide. It does include the really quick links. You can just click on them and go. It has a couple of materials. The Legislative Ask Workbook is what I would say the one that you want to asterisk. If you don't look at anything else, pull up that workbook. It gives you all of the behind the scenes information you need to know. It tells you what the core talking points are. It gives you the highlights. It has how each member of Congress can help, high level, and then we give you a lot of research data points. If they're asking about numbers and figures, we've got those in there. We have specific talking points for each of the asks. You'll also see in the link the leave behind documents. Those are the formal documents that we've created that will be shared with the legislators themselves. You can obviously use this yourself. You can take a look at it and use it. A lot of the talking points are exactly the same as what will be in the workbook. So the workbook is more in-depth. And you will also see a spreadsheet. We're calling it our research Excel spreadsheet, because we all know that I love to do my deep dives and gather as much information to make us evidence-based and provide you facts and figures. So be sure to check out that Excel spreadsheet. It'll have a list of for the 2 bills that do have bill numbers, so the Safe Step Act and the Help Co-Pays Act, we do have separate tabs. It'll have every state, all of the members, who is signed on as a co-sponsor, who signed on as a co-sponsor for the last, for the 116th Congress, but has yet to do so for this 117th Congress. It also has staff notes in there from when we met with that member or their staff person as well. And when I say staff, I'm referring to myself, Anna, someone on our coalition for the Safe Step Act. But those are staff meetings that you can check out, and you can always make a casual comment such as, I understand you might have had a meeting with our staff partners a couple months ago or a couple weeks ago. We are following up. We are part of the same coalition. We're working with a number of different advocacy groups, patient and provider organizations. There are over 250 of us that are working in coalition together on the Safe Step Act. And there are several organizations that are working together in coalition on both Part D and on the Accumulators Bill, the Help Help Co-Pays Act. So none of these are Arthritis Foundation advocates going at it by yourselves. These are all issues that we are working together. So if you have your legislative ask workbook, I encourage you to pull that up right now. You can take notes on it. I'm just going to do a highlights overview, since we have a little time, of what each of our asks are again that Anna just went over. The first one is on the step therapy ask. The primary things that we are looking for here, especially in the House, are explicitly not only to encourage them to join as a co-sponsor, which we've done for years past, but this year we have a little more momentum. There seems to be an appetite. You can watch the legislative ask video. We want to say that we are encouraging them to hold a hearing in the committee and to ask for a bill markup. That's the most important one. Check out the legislative ask video for more information there. And then, as always, outreach to other members of Congress is just as important. They're all friends, they're human beings, they talk and get coffee with their neighbor across the hall. So we want to encourage them, even if they're not on one of the committees of jurisdiction, that they still know people in Congress. The second bill, the second bill is the Help Co-Pays Act. That is HR 5801. That is the bill that Anna was talking about. That is our accumulators bill that we're working on. The final one is also on Part D Medicare costs for out-of-pocket costs. You'll see those talking points in the legislative ask, and we are encouraging members to co-sponsor the Help Co-Pays Act, support committee hearings, ask for a bill markup. Those are the primary things, but you will see all of that bullet pointed, and then we go over it in the legislative ask video. So when in doubt, pull up the workbook. That is the best resource. You can always ask us for help. We are going to have open office hours all day tomorrow. One of our staff members will be available on hand to answer questions. If you go into a meeting and then you say, you know, I have 3 more coming up, can I ask you this question in the middle of the day? That is what we're here for. So don't be afraid. You can send us an email. You can pop into the office hours briefly. And I believe that there are some questions in the Q&A that we might do our best to try to answer before we go into the asks with Soapbox and Kevin.
Yeah, I think the one, and we were going to cover this anyway, but just, and then Kevin, this is like the perfect segue, I think, to you, because you were the one who actually did this, which is that as the Hill offices are getting the meeting notices, the leave behind materials are in those meeting notices. So it makes it very streamlined, correct? And so when you all go into your meetings, you can say, you can refer to the leave behind materials that were in the meeting notice, and then go from there. That way, when you're wrapping up your meeting and you're thinking about what you want to include in your follow-up, you can just focus on your own personal story and the things that you want to follow up with, and not worry about having to locate the leave behind materials. So with that, Kevin, I would like to introduce Kevin Schultz, who has been working with us for many years and has done many of these events with us before. Many of you probably recognize him. We are so incredibly grateful to have Soapbox back with us this year, and I'm going to turn it over to you.
All right. Thank you, Anna. Thank you, everybody. We are so happy to be working with you again and scheduling your meetings with the Hill. I have some slides that are going to be brought up, and I'll talk about those, but I want you to know that I will be talking to you about your schedules, how you see your schedules on your mobile tool, how you'll see your team, how you will see things like how to get feedback after each meeting and how to upload a photo to the feedback form. Also, how to see if your member of Congress has co-sponsored the bill that's important to us. So let's bring up the first slide, please, and show the map of where folks are from. The next one. So there's more than 40 of you that are going to be conducting meetings tomorrow from 23 states, and you will be conducting more than 80 meetings tomorrow in the span of just a few hours. So you will be busy tomorrow. You can see that 34 of those will be with Republicans, 49 will be with Democrats, and we even have a meeting with an independent. Some of you are in teams for these meetings, and then some of you who have been notified that you're alone and are okay to be alone are alone in your meetings, but you're going to be busy all day tomorrow, and I'm going to tell you how to see your schedule next. So let's go to the next slide, please. So I'm going to take you through the Soapbox mobile tool. By now, you should have received an email from Soapbox that reveals your own individual schedule in real time. If you did not get that email, not to worry, I will take care of you at the end of the briefing. But I want you to know that the mobile tool is not an app. It is simply a website. There's nothing to download. And let's go to the next slide, please, because I'm going to show you what happens when you put in your code. So the first time you go in, it will ask for a cell number. It does not mean that you have to use the mobile tool on your cell phone. In fact, we encourage you to use the mobile tool on your laptop or your desktop. Big screens are key for these. It's also easier to type the feedback in after each meeting when you're using it on your desktop or your laptop. We ask for your cell number for an important reason, so that we can text you reminders to your phone 1 hour before each meeting. While they're all listed in Eastern time on your schedule, we know many of you are in different time zones. So that's why we want to remind you that a meeting is coming up. In addition, if a change were to happen during the event tomorrow, you will get a text with a push notification about that change. Next slide, please. So once you put your code in and enter your phone number, you'll land on this screen on the left. There's a few buttons I want to point out to you. And if we advance in the slides, they will come up one by one in terms of the circles around each. And then it will land on our phone number, which I want to have up there while I'm speaking. So there's a red button at the bottom. That's the most important one I want to point out. If you have any troubles tomorrow during the advocacy day with whether it be the technology, whether it be with your schedule, and also right after this briefing, when we have our practice session, we have people here to answer the phone if you have questions. So there's the phone number for you when you press that red button. There's also a button for documents. Anna mentioned that we are sending the documents with our confirmations tomorrow, but I want you to know that you can find the copies of our issue briefs in documents, which detail what we're asking Congress to do. You can print those, you can pinch, you can zoom, you can even email them to yourself. You can email them to a staffer who says they didn't get a copy. While we send them with the confirmation, staffers still sometimes say, I haven't had a chance to look at them or I haven't seen them. And you now know that you can forward them from the mobile tool if they ask you to do so and if they give you their email address. You can also always call our help desk and we'll resend it if they say that. You can also see on the lower left there's a button for the bios of your members of Congress. So you can do a little research ahead of time. There's a button for your team right there at the top in the middle. So you can see who you're teamed with for the practice session and for the advocacy day tomorrow. There is the schedule button on the upper left. It has all of the links to your meetings. And that schedule is in real time, meaning if something changes, you will see the change. And I stress that because those of you who have done this before know that Capitol Hill's in flux, so they are often changing meetings. So that's why I point that out. If we go to the next slide, I'm going to show you what happens when you press the Your Team button. Your team has the exact same list of meetings. That way you don't have to reconfigure each meeting between each appointment. You come up with a spiel, you march through your day together, you support one another. If you want to contact someone before the meetings tomorrow, we put the email addresses in there. When you meet for your practice session afterwards, if you're in a team, you can always share your cell numbers with each other, but we wanted to at least give you the email addresses of those in your team. Next slide, please. When you click on the Your Schedule button, you will see the meeting times pop up right next to the member's name, and they are in chronological order. If it says with member, you are on the schedule of the member of Congress. If it has the staffer's name and title, that is the staffer you are meeting with for the meeting. And then we've put the link for the meeting right below that. You can simply press on the link to join the room. There is no lobby. There's no waiting area. There are no rosters to approve. Soapbox is opening all of these rooms for you ahead of time. You can just quickly get in by pressing the link. Under each link, you see a phone number and a PIN. You don't have to use that. It's simply a backup in case you're on and you're having troubles with your camera or you're having troubles with your microphone. Just know that you can call in if you need to. If you happen to see a TBA instead of a time, and I think there was just one this afternoon, so that should only be one person. It's just an office that is waiting until tomorrow to confirm the time. It's somebody from Pennsylvania, and we'll keep you informed if it's not filled out by tomorrow afternoon. And then I also want to point out that the key committees are tracked. So if your member of Congress is on one of our key committees, we put that in brackets at the bottom there, right above the feedback button. And then also, you've told us over the years that you like to use the schedule as sort of a cheat sheet so that you know whether your member of Congress has already done something we're asking for, so that you can simply say thank you if they've already co-sponsored the bill. and watch them light up when you say thank you for doing something. So for tomorrow's event, we've tracked on the schedule if your member of Congress has co-sponsored one of our bills. So if you see the word copay on the schedule line next to your member of Congress, you know your member has co-sponsored the Help Insure Lower Patients Copays Act. If you see the words Safe Step, you know your member has co-sponsored the Safe Step Act, and you can simply say thank you. Again, if you see the word copay, you know your member has co-sponsored the Help Insure Lower Patient Copays Act. And if you see the word Safe Step, you know your member has co-sponsored the Safe Step Act. On the top of the meetings, you can see there's an orange box. That is where we put the link to your practice session, which will be right after this briefing, and I'll talk about that in just a moment. One other thing I want to point out is that feedback button there at the bottom. Let's go to the next slide because I want to show you what happens when you click on the feedback button. 5 questions pop up, or the amount of questions we've put in there. You don't have to say who you are. You don't have to say which meeting you're talking about because the mobile tool already knows that. It knows who you are because you put your code in. It knows which meeting you're talking about because you click the feedback button right under the meeting. You simply need to answer the questions that are there. At the very bottom, you see a camera icon. You can take a screenshot of your meeting. Simply ask the member or the staffer ahead of time, hey, do you mind if we take a picture? And then you can take a screenshot and then you can upload it there at the bottom of the feedback form. And I know Anna and Stephanie and the whole team really love to get those photos. So please try to take a photo tomorrow of your meetings. Let's go to the next slide, please. So we use Zoom. We use Zoom for these virtual meetings because it's what the Hill likes to use. Next slide, please. The good news is you're on Zoom now, so you got in, you're good to go. If you happen to be using a different computer or a new computer tomorrow, remember, you will have to download Zoom if it's a different computer tomorrow. All right, next slide, please. So there's a couple of things I want to point out about this Zoom interface. Most of them you already know. You know where the microphone is for mute. You know where the camera icon is there on the lower left for your camera to turn on. But there are a couple of things that are important for you to know. The chat feature. If you happen to use chat, remember that the member of Congress and the staffer can see what you're typing. So be careful with that. And then also all of your meetings, well, I should say most of your meetings are video meetings. In a few cases, the staffer may choose not to use the camera. We've told them that's okay if they choose to do that. It's not a slight. Sometimes they feel like they're not dressed for success on that day, or maybe they're in their apartment and they don't want folks to see into their apartment. So just know if they're using audio only, it might be for that reason, and we've said that's okay. So for nearly all of the Hill meetings, you just click on that link and you go into the room. The only time you would not click on a link is if the member of Congress gave us their own phone number and PIN. And I think about offices like Senator Cornyn, Senator McConnell. Those are offices that like to do that often. So you'll see a cell phone, not a cell phone number, a phone number and a PIN, and you just call that, enter the PIN, and that's how the meeting will happen. Those instructions are right there on your schedule, so it will be clear to you. But if you have any troubles, you'll call our help desk. I'm about to come to the end of my presentation, but I want to prepare you for the practice session after this. So let's go to the next slide, please. Once this briefing is over, you will click on the practice link. And the way you do that, let's go to the next slide. You go into the Soapbox mobile tool, you click on that green button for your schedule, and then you will see that bright orange box at the top. You will click on the link in that orange box and it takes you into the practice room. You can check that your microphone works. You can check that your camera works and that you can mute yourself. And as you're doing that, you will notice that if you're in a team, the others start to come in with you and then you can practice your meeting. If no one else joins and you are alone for the practice session, do not worry. Just test the mic, test the camera, and once you've done that, you're good to go, and you can feel comfortable that you'll be ready for tomorrow, and your evening is done. All right, next slide, please. A few tips I want to give you about these meetings. Remember that we don't bring up the election or campaign contributions in a legislative meeting. Remember to stay on message so it's heard loud and clear. Sometimes it's easy to get off track, or if the member starts talking about things back in the district, We want to talk about that, but remember, we have to get right to our ask. So make sure we stick with our legislative ask because time is limited. Remember to put ourselves on mute if we're not speaking. We want to put our pets, our children, our loud appliances out of the room. Staff may choose to join the meeting by phone. We're gracious if that happens. And while we can ask permission to take a screenshot of our meeting, remember that we don't want to record the meetings or video them, or the office will end the meeting prematurely. Now, we will put the email address of each person you meet with on your schedule at the end of the afternoon so that you can follow up with a thank you. Following up is a way that they remember you. So we will put that email address of the staffer. It will be the email address of the scheduler if you're meeting with the member so that you can send that thank you note. We have requested that each of your meetings be scheduled 1 hour apart. If you happen to see 30 minutes between meetings, it's because the office came back to us and said they could not do the hour. So at the start of your first meeting, you can say, we have a meeting 30 minutes after this one, so we're happy to keep it to 25 minutes. They will find that very gracious and they'll be happy to do that. And then final tip for you. As the afternoon wears on, staffers and members get behind just like we do on a busy day. So that may happen a couple of times tomorrow. Wait 5 or 10 minutes. Everyone stay in the room, wait 5 or 10 minutes. And then after that, if no one has shown up, have one person call the help desk. We have direct numbers into these offices. We have their email addresses. We'll reach out to them. Inevitably, they've simply forgotten or they're late and they pop right in and you have your meeting. So that's why I say be sure to stay in the room and have one person call us. And with that, I'm going to stay on here for any questions. And I'm also going to tell you that if you did not get your schedule code, feel free to type your name in the chat and I will type your code back to you so that you can go right into the practice session when we're done here. All right, Anna, do I just send them right in or shall I toss it back to you?
I am going to ask Stephanie Livingston if she has any final housekeeping notes or just, you know, words she might want to say before we send them in.
All righty.
Sure, everyone. Hopefully you can hear me all right. And I apologize that I am orange. That's what happens when it gets late. But just as some kind of concluding thoughts and all of that, like Kevin has said a few times, we're hopeful that you can use a little bit more of your evening to go into your practice sessions, chat with your team members, get your talking points ready for tomorrow. Those links will be available tomorrow as well. And we've alluded to the fact that there will be our meeting office hours all day tomorrow from 9 a.m. to 5 p.m. Eastern time. All of that information is in the event app. It's in the event guide. It's the PDF, and we're happy to send that information again over email just so that you have it. We're here to help tomorrow. We're happy to join any and all of your meetings if you feel like you need some assistance there. But other than that, myself and Kevin at minimum will stay on the line and answer any questions that anyone has in the chat. But thank you so much for joining and welcome to the Platinum Ambassador Assembly. So go enjoy your practice sessions and we'll be here to answer questions.
Jennifer, I see your note. I'm putting your code here. Jennifer, there you are.